Have you ever wondered why the burden of infertility often falls on women when in reality men can be equally responsible? Let's take a moment to think about it. In many cultures around the world, the blame for failing to conceive is often placed on women. The truth is, this is a common misconception that needs to be addressed. Infertility is not a gender-specific issue. It's a human issue, and it affects both men and women. Let's introduce a term that's not as widely discussed as it should be: male infertility. Yes, you heard it right. Men can and do experience infertility. According to the World Health Organization, around 1 in every 7 couples globally may experience infertility. And in about 40% of those cases, the issue lies with the male partner. Now, you might be wondering, how is that possible? Well, male infertility can be caused by a number of factors. It could be due to low sperm production, abnormal sperm function, or blockages that prevent the delivery of sperm. Illnesses, injuries, chronic health problems, lifestyle choices, and other factors can also play a role. The point we're trying to make here is that fertility issues aren't exclusive to women. Men can be equally responsible, and yet the narrative around infertility often paints a different picture, one that unfairly places the burden on women. This not only perpetuates harmful stereotypes, but also hinders the appropriate diagnosis and treatment of male infertility. Why is this crucial to understand? Because acknowledging that men can be a part of the problem is the first step towards finding a solution. It's the first step towards creating a world where couples who are struggling to conceive receive the support they need, regardless of which partner is experiencing fertility issues. So let's change the narrative. Let's start acknowledging male infertility and work towards creating a more understanding and supportive environment for all those affected, because infertility doesn't discriminate, and neither should we. So it's high time we shed some light on male infertility. But what exactly is male infertility, and how does it affect a man's ability to contribute to a pregnancy? Let's delve into that. Male infertility is a health condition in men that lowers the chances of his female partner getting pregnant. It's like a cog in the wheel of the natural process of pregnancy, disrupting the smooth journey from conception to birth. Now, what causes this disruption? More often than not, male infertility can be attributed to issues related to sperm production or delivery. The main culprits are often low sperm count, abnormal sperm function, or blockages that prevent the delivery of sperm. Imagine a bustling city where cars represent sperm. Now, low sperm count is akin to a lack of cars on the road. This scenario doesn't bode well for traffic, or in this case, fertilization. It's like having a lottery ticket. The more you have, the higher your chances of winning. Similarly, the more sperm, the higher the probability of a successful pregnancy. Next, let's talk about abnormal sperm function. This is when the cars or sperm are there, but they're not functioning as they should. Maybe they can't navigate the roads properly, or their engines aren't working right. This hampers their ability to reach their destination, the egg, and fertilize it. Lastly, there might be blockages that prevent the delivery of sperm. Think of it as roadblocks or detours that prevent the cars from reaching their destination. These can be caused by various conditions, including certain genetic disorders, or they may be a result of damage or injury to the male reproductive organs. Understanding the nuances of male infertility can be quite complex due to the many factors at play. However, it's essential to remember that infertility is not just a woman's issue. Men contribute to infertility in about half of all cases. Knowing what male infertility is and what causes it is the first step towards addressing it. So let's take that step together and continue our journey towards understanding this crucial health issue in the scenes to come. Are there any signs that could hint at male infertility? And who is at risk? The signs of male infertility can be subtle, and sometimes there may not be any obvious symptoms at all. However, there are a few indicators that might suggest a potential problem. These can range from difficulties with sexual function, such as trouble maintaining an erection, or a decreased sexual desire, to physical symptoms like pain, swelling, or a lump in the testicle area. Men may also notice a decrease in facial or body hair, or they may have issues with ejaculating too quickly or not at all. Now let's talk about the risk factors. Age is a significant one. While men can remain fertile for much of their lives, their fertility does naturally decline as they age, starting around the age of 40. Lifestyle factors can also play a role. This includes things like smoking, alcohol use, drug use, obesity, and even stress. Each of these can negatively impact sperm production and overall fertility. Certain medical conditions can also increase the risk of male infertility. These include hormonal imbalances, infections that affect the reproductive system, certain genetic disorders, and conditions that cause blockages in the part of the testicle where sperm is stored. Even previous surgeries can potentially impact fertility. Exposure to environmental factors can be another risk. This can include exposure to radiation or certain chemicals, as well as overheating the testicles, which can happen from prolonged sitting, tight clothing, or even using a laptop on your lap for extended periods. Lastly, certain medications can also affect fertility. These can include certain antibiotics, antifungal medications, and medicines for high blood pressure or depression. So if you're experiencing any of these symptoms or find yourself in one of these risk categories, it's essential to speak with a healthcare professional. They can provide guidance and discuss potential next steps for diagnosis and treatment. Understanding the symptoms and risk factors can help in early detection and treatment. How does one get diagnosed with male infertility, and what treatments are available? These are the questions we'll be tackling today. It all starts with a comprehensive medical evaluation. The physician will take a detailed medical and sexual history, perform a physical examination, and order laboratory tests. One of the most common diagnostic tests for male infertility is semen analysis. This is a simple test that evaluates the number, shape, and movement of sperm. It's like a report card for your swimmers. If semen analysis results raise concerns, further tests may be needed. Hormone testing can help determine if a hormonal imbalance is causing infertility. If the sperm count is low, genetic testing may be performed to identify specific genetic abnormalities that could be contributing to infertility. Once the cause is identified, the treatment can be tailored to address it. If a hormonal imbalance is at play, medication may be prescribed to correct it. If there's a physical issue like a blockage in the sperm transport system, surgery might be the answer. But what if these treatments are not successful? Well, we live in an era of remarkable scientific advancements. Assisted reproductive techniques offer hope to those who might not have had any just a few decades ago. Intrauterine insemination, or IUI, involves placing sperm directly into the woman's uterus around the time of ovulation. In vitro fertilization, or IVF, is a process where the egg is fertilized by the sperm outside the body, and the resulting embryo is then transferred to the woman's uterus. Intracytoplasmic sperm injection, or ICSI, is a type of IVF where a single sperm is injected directly into an egg. This can be particularly beneficial for men with very low sperm counts. So, you see, the journey to parenthood may have its bumps and detours, but it doesn't mean it's impossible. Male infertility is not a dead end. With modern medicine, many men can still father children. Remember, every journey begins with a single step, and the first step to overcoming male infertility is understanding it. Can male infertility be prevented? And where can one find support? These are questions that many individuals grapple with, and today, we're going to tackle them head-on. The first step towards prevention is awareness. Male infertility is often influenced by factors that can be controlled through lifestyle choices. Maintaining a healthy lifestyle is crucial. This means adhering to a balanced diet, ensuring regular exercise, and avoiding harmful habits such as smoking and excessive alcohol consumption. These actions can significantly improve overall health and, in turn, fertility health. Next, regular medical checkups play a pivotal role in early detection and prevention of health issues that could lead to infertility. These checkups can help identify potential problems early on, making them easier to address and treat. It's important to remember that the earlier an issue is identified, the better the chances of successful treatment. But what about support? Remember, infertility is not a journey you have to embark on alone. There are numerous resources available to provide emotional support and guidance. Support groups, both online and offline, can offer a safe space to share experiences, fears, and hopes. They can also facilitate connections with others facing similar challenges, creating a network of understanding and empathy. In addition, mental health professionals can provide individualized support, helping individuals navigate the emotional challenges that often accompany infertility. They can provide strategies to cope with stress, manage expectations, and maintain a positive outlook. Lastly, medical professionals specializing in fertility issues can offer expert advice and treatment options. They can guide you through the process, providing clarity and reassurance along the way. With awareness, prevention, and support, male infertility can be tackled effectively. Remember, it's okay to seek help, and it's okay to talk about it. Infertility is a shared journey, and no one should feel isolated or alone. So let's continue the conversation, spread awareness, and support each other, because together, we can make a difference. With awareness, prevention, and support, male infertility can be tackled effectively.